Sickle Cell Conference, the first ever history in the making sickle cell disease conference in Australia. We're excited to have people like you with very relevant, important information that we need to know. And thank you so much for accepting our invitation. For people that don't know me, I'm Agnes. I'm the founder and executive director of Australian Sickle Cell Advocacy. With us today, we have Elizabeth Tisoma, who's the CEO for Medicines Australia. We invited Elizabeth because we feel as advocates, as caregivers, and people living with sickle cell disease, there's so much that we don't understand that's behind what we see when we're with the doctors. And we thought this was a very informative session and very important session for us to know some of the lay languages that we can understand, especially being that sickle cell disease is a rare disease and in Australia, and we don't have access to all the medications that's available internationally. So we are very, very thankful for you to join us. So welcome again, Elizabeth. Thank you for joining us.
Oh, thank you very much, Agnes, for inviting me, and I'm delighted to be here. I'm really pleased to be here, and thank you very much for inviting me. And I just wanted to make a few remarks about, firstly, who Medicines Australia is and who we represent, and then reflect a little bit on how we as an industry and a peak body representing the industry can contribute to the health of Australians living with chronic illness. So Medicines Australia is the peak body for the research-based medicines industry in Australia. And what that means is that the Medicines Australia member companies are those that are involved in the discovery or the invention, the research, development, clinical trials, manufacture and supply of prescription medicines and vaccines to Australia. The membership therefore comprises predominantly large multinational pharmaceutical companies from around the world, but also some smaller companies from around Australia, and can include some biotech companies who are right in the early stage of discovery. The important thing about these medicines is that we are constantly innovating. There are new treatments, new breakthroughs in understanding of disease that are being discovered every day. And we see an incredible collaboration between scientists and researchers to find new ways to treat difficult diseases, whether they be new diseases or new findings about disease, or whether they are those well-known chronic diseases that affect so much of our population. So it's a really important industry collaboration and partnership across the whole ecosystem, from the universities and the researchers and the discovery through to the commercialization and making things available to the community. And the Medicines Australia membership is a fabulous switch to slides from my team, thank you. These are the members of Medicines Australia at the moment, but obviously that membership can grow as new companies join into Australia's policy landscape. Now, just reflecting on chronic disease in Australia, 1 in 2 Australians, according to the AIHW, had one or more chronic conditions in their data of 2017-2018. 1 in 2 hospitalizations involved a chronic disease, and nearly 9 out of 10 deaths were associated with a chronic disease. Now, we know that there are lots of factors that are contributing to that. Part of it is that we have an aging population, so there is an increasing incidence of chronic diseases. We also see that there are other factors that are actually contributing to health of Australians. There are inequities in our healthcare system, inequities from metropolitan versus regional areas, and and marginalized populations, differences between different ethnic groups and populations. We see that we struggle to get the same health outcomes in our Aboriginal and Torres Strait Islander populations. And there are some populations that are completely missing out. And I was on a call this morning, on a Zoom this morning, where we identified, pediatric populations are a population that commonly miss out on access to medicines and treatments. And that's because commonly discovery and research is done in adult populations, and that the pediatric populations are sort of thought later. And there are many reasons for that. Some of those are around ethics and how do you treat children with experimental drugs that might have adverse impacts. So it is a difficult area to try and address those inequities. But the fact is those inequities exist. Medicines Australia has been saying for a long time how important health is to the economy. The Australian government has for the last several years said, we have a strong economy and therefore we're able to provide a universal healthcare system, and it's the strong economy that has bought and purchased good health. But what we've seen in COVID is actually, it's sort of the other way around. If you don't have good health, you don't have an economy. So the importance of good health to the economy has become inextricably linked, and it's no longer doubted. If you have not got your health, you cannot contribute to the economy in the way that you would if you were healthy. So we know that one of the things that contributes to good health is access to the appropriate, timely healthcare. In fact, we've seen during COVID that with lockdowns and with restrictions, people have been reluctant to go to their doctor for their normal treatment for chronic disease, or they haven't gone to a doctor if they've had a new symptoms or some new sign or symptom of a disease. And this is going to have far-reaching effects on our healthcare system in the years to come, as we see people lose control of their chronic illnesses, and there are downstream effects of not having managed their chronic disease during COVID, or indeed that we are identifying and diagnosing diseases later in the life cycle of the disease, so that the treatment is maybe less effective because it wasn't screened for and discovered early on in that treatment. So COVID is going to have an enormous effect on acute illnesses, but also on chronic diseases moving forward. And one of the factors that really contribute to managing chronic disease, not only early diagnosis and early treatment, but some of the new innovative medicines and new technologies that are coming through the pipeline that will actually have a greater impact on those diseases. As long as we have early diagnosis and early treatment, we also need to ensure that we have availability of cutting edge, breakthrough, new innovative treatments to treat many of these chronic diseases. One thing that's become clear in our analysis of Australia's access to innovation and access to new medicines is that, quite frankly, patients wait too long to get access to innovative medicines. We've looked in our data principally at the brand new innovative medicines that for the first time they're used for any illness. And we see that Australia lags way behind the OECD average on making those new innovative breakthroughs available to Australian patients in a timely way. However, we also know that there is quite a long time for patients to wait between a TGA registration to the agreement by the Commonwealth to fund a medicine, just in the normal processes, whether it is an added indication or a new indication for an old drug. There is too much of a lag time between when it is marketed, authorised for sale in the market, and when it is actually funded and subsidised through the Pharmaceutical Benefit Scheme. So essentially, we know that there is a big piece of work that needs to be done for Australia to speed up the time from TGA registration to PBS reimbursement, so that we can not only compete with other comparable countries, but so that Australian patients don't get left behind and don't wait too long for access to their new medicines. We've also identified that the way the process operates at the moment, it hasn't been updated or thoroughly reviewed, or independently reviewed at least, since it was introduced in the early 1990s. And this system of health technology assessment that determines whether a medicine is value for money for the taxpayer and for the Commonwealth to fund it and subsidise it for patients is quite a lengthy process. And it does not necessarily consider consumer and patient input until quite far down the pathway of making the decision. And so we also think that there needs to be a greater voice, or a great earlier opportunity for patients to contribute to the decision-making of the Commonwealth on whether they should fund and why they should fund medicines for certain groups of patients. We also know that the technologies and the methodologies that are used to assess whether medicines are value for money and whether the Commonwealth will fund them have not necessarily kept pace with developments and scientific breakthroughs. There are now medicines and treatments and services and gene-targeted therapies that are not going to be assessed in the traditional way, the way our system is set up. And we need to look at the pathways and the mechanisms that we use to evaluate medicines and make sure that they keep pace with the developments and amazing scientific breakthroughs. And we also think that there are benefits of medicines that are not adequately considered in determining whether the Commonwealth will fund them. You know, the benefits, the broader benefits to society, the benefits to patients, the benefits to their carers or to their family. And I've had many conversations with people during the course of the House of Reps inquiry into access to new medicines and novel technologies about treating a child with an illness. You're not just treating the child, you're also treating the whole family. There is an impact on the siblings, there is an impact on the parents, and there's an impact on the broader family. And none of the benefits of treatment for those factors are taken into account in the decision making. So we really think that there are opportunities for us as a nation, for us as a country, for us as an industry, and for you as patients to contribute more to that decision making. What are the things that the Commonwealth takes into account when they're making a decision about whether something is value for money? Something that you might value is going to be entirely different way that a clinician might value it or an industry person might value it. Medicines Australia has been for the last 12 months or more negotiating what is called a strategic agreement with the Commonwealth Government. We have a current strategic agreement with the Commonwealth Government which expires in 2022, and through that agreement there are a number of commitments for us to work together on a range of activities. Principally, the agreement provides an opportunity for us to create savings, which frees up funding so that new medicines can be listed on the Pharmaceutical Benefits Scheme. But also there are a number of policy activities that we also want to engage in to improve the processes. And really, for the first time ever, the new strategic agreement that has been struck between the industry and the government has a really strong commitment to reform and to improve the system. We identified, as you do with all negotiations, where is our common goal? What is our common objective? And there is absolute agreement that we need to speed up getting patients access to the medicines that they need. Excuse me. So we have a shared goal to reduce the time from TGA registration to PBS listing. We also have a complete commitment and shared commitment to improving the ability for patients to engage in the system. As Agnes pointed out, it's a complex system. Patients often don't know how the decisions are being made or what information is being considered or how they can contribute to that conversation, how you can make sure that your important elements of quality of life or your views on a medicine's importance to you and your community can be taken into account in the decision making. So we have a shared goal to improve the patient involvement in the process for assessing and listing new medicines on the PBS. And we believe that through that, we will deliver better outcomes for patients. If we can improve the time it takes to make those medicines available, if we can improve the decision making to take better account of patients' views on what is important and what is valuable to them, then we will get better outcomes for patients. And so now's the time from delivering and signing this agreement for us to actually work together with the government, but also with patients to ensure that we have appropriate processes, rapid access to new innovations, and access to medicines on the PBS. So the first and most major reform is going to be an independent review of the health technology assessment system. And that is looking at the pathways, the methodologies, the processes, the technical aspects, as well as other aspects of valuing a medicine to make sure that they keep pace with technology and keep pace with advances in science. And that review will start now and take place over the next couple of years to be implemented by 2024. There's also agreement to co-design with patients and with patient groups a new process to enable consumers to be involved much earlier in the decision-making for whether to fund medicines on the PBS. So patients need to be involved in that process, and the Commonwealth and the industry will work together to ensure that we capture what it is important to patients in being involved in that process so that that can be taken into account in the decision making. And also we have created as usual, a commitment to create some savings and free up some funding to ensure that new medicines can be listed on the PBS as quickly as possible, and that funding is not the barrier to listing new medicines. So I just thought I'd talk a little bit about the enhanced consumer engagement process. Now, in our agreement, there are some words. It's obviously not the role of the industry to tell patients how to be engaged in a process that is, at the moment, working very closely with industry and the Commonwealth. But what we have identified is that industry and the Commonwealth working together need to do more to hear what patients need to say. So in our agreement, we have agreed with the Commonwealth that from the start of the agreement and as soon as possible after the agreement starts on 1 July 2022, the Commonwealth will lead a process to co-design with patients and clinicians and the industry and other healthcare professionals what an enhanced consumer engagement process for the PDAC would look like, so that we can incorporate consumer perspectives into the PDAC decision-making processes, so patients can highlight the value of new medicines to them beyond the cost and the health outcome, and so that we can look at and reflect on the new technologies and innovative technologies that are actually addressing unmet clinical needs and how do patients engage with that. Now, it might be that patients want to engage in the process by explaining how their lived experience with the disease affects them. But it might be that patients also want to contribute their lived experience of being on a clinical trial when they've benefited from a medicine, so that the PDAC have the view of what is important to a patient when they are suffering from an illness, but also what are the important benefits of a treatment that are not just the health outcome, but what are the other values of a treatment that the patient has benefited from during their journey in a clinical trial, for example. The most important thing is that patients need to be defining what is valuable to them at the start of the process, so that the PDAC can take that into account when they're looking at the technical assessment on value for money, and also take into account those slightly harder to define benefits that patients really get from having access to new medicines. So we think that this is a really strong signal from the Australian government that they've heard the call to action from patients, that the processes need to be more transparent, that patients need to be part of them, and that they need to be better and quicker at resolving the issues and getting medicines to patients as quickly as possible, particularly when we have breakthrough innovations that are going to be coming down the pathway very quickly. Now, there are some other aspects to the agreement which are also very important for the patient community. The industry is going to be looking at horizon scanning and introducing an annual forum where we can actually look forward, not just improve the processes for here and now, not just improve how patients engage with what's available today, but how can we help the government and patients be aware of what's coming down the pipeline in 3 to 5 years' time, and how can we make sure our system is ready to assess that so that we can have the new innovations that aren't even imaginable today available as quickly as possible when they do land on the doorstep of the Australian Health Technology Assessment Evaluators, and they say, yes, we're ready for this and we're looking forward to it, so we can make our system ready to make things access to patients as quickly as possible. I think I can leave it there, Agnes, and just, I wonder if there is an opportunity for people to ask questions or engage in the chat, or if there's anything that you wanted to ask me to expand on.
Thank you so much for that presentation, Elizabeth. Well, we don't have questions in the chat box yet, and my team, please check Hoover, because I went through the Zoom. We can put it in the chat box. If there's any questions, please just raise your hand and you can be promoted to speak to Elizabeth. But I had some questions that we prepared beforehand. As we said rightly from the beginning, Elizabeth, this is the area of business that we do not understand. You know, for me, when we had, I think one of the journalists called me to find out, get some information from me when they heard that Adakview was approved in Australia. And for me, that is it. Telling patients that it's ready, we can go and ask our hematologist that the medication is ready. And then I was like, no, when I spoke to Anthea and them, they're like, no, it's a long system before you can actually have that medication on PBS. So this is the information we thought we really need to know. And the reason why we thought this was a very important information to find out. You've spoken about, you know, involving patients in the new system that you're going to have in terms of, you know, patient information and patient access, consumer engagement. I've seen the dot points, but how do lay patients like ourselves know when we are supposed to be involved? Do we get invitations? Do we see public notices? And how do we get involved in those engagement?
So at the moment, it's quite difficult, I think, for patients to engage in the process. The PBAC publishes the agenda of medications 10 weeks prior to the meeting, but you would need to know to look at the agenda, see if there is a medication that's relevant to your illness on that agenda, and then put yourself into the process. What we're hoping with the new system is that that it will be the responsibility of the Department of Health and the PBAC to identify what medications will need really early stakeholder engagement, and that they will pull these stakeholders in, that they will reach out to stakeholders and say, this is a medication that's important for your disease area, your illness area. We really want to hear the patient's viewpoint. But I think that that's still going to have some shortfalls, because you have to make sure that the Commonwealth has all of the stakeholder information that they need. And they're going to make some choices about which medications they're going to have a stakeholder engagement process for. And whether it's, because it's going to take time and it's going to have some resources attached to it, they're going to make some choices in the early days about making breakthrough medicines, high unmet clinical need, and reach out to those stakeholders, which isn't going to necessarily solve the problem if you're not in that kind of medication group. How do you engage in the process? And I think that we had a conversation with some patient groups this morning. I think that's a real area of work to be done, is how do we know, how do we involve stakeholders who may not know? How do you reach out to them? How do you ensure that your contact list for the right stakeholders, for the right disease area, are aware that there is a medicine on the PBAC agenda that needs to have some input? And then when you know that there is going to be the discussion about your medicine, how do you engage with the PBAC? What is the process for doing that? The process hasn't been designed yet, and we need patients to help design what that process looks like. So what I can commit to is, when we work with the Commonwealth to co-design this process, making sure that I connect them to as many stakeholders that I know, so that we can invite those stakeholders in to contribute to that design process. And I know that, Agnes, the Australian Sickle Cell Advocacy Group is on our list. And so certainly when we get involved in that process, we will make sure we invite you to participate in designing what that system will look like.
I think that's very, very important, because I remember just a few days ago, I was speaking to Jessica. I remember Jessica, when we came for the event in Canberra, patients, everyone, whether you are learned or not, the multicultural community, some people that we have, especially in the sickle cell community, there's some people that have lived very tough conditions and they've come here as migrants. They don't even understand the hospital or the healthcare system in Australia. I think one of the things that I just want to find out, will you also take into consideration these multicultural groups, and how do we engage them in this system as well? We do sort of have information that is translated in different languages to be able to, for them to also be included in this engagement.
So again, this is a conversation that's, it's just starting, but yeah, it's critical. There is an assumption when we talk about consumers or patients that we mean everybody, but actually you have to be explicit, particularly, for example, when you're talking about Aboriginal and Torres Strait Islander consumers, because they are different, a different patient group. When we talk about culturally and linguistically diverse groups, they're different. So we're going to have to make sure that we're very alert to being explicit about how will we engage with different groups. As I mentioned when I was talking before, those populations that are actually missing out for reasons, maybe because, as you say, the English is not their language, or they're new to Australia and they don't understand the health system, or they're just a group of people who miss out because they're geographically located remotely, or they're children and there isn't an indication for them, or they're Aboriginal and Torres Strait Islander patients who have a different need and a different way of interacting. So we are going to need to make sure that we are explicit in consulting with every group and making sure that we can see how the system needs to be flexible to deal with those differences that you're pointing out, Agnes, because they're really, really important. And I don't know the answer yet, and I'm quite sure that it won't be a perfect system to start with, but it does, there are many voices highlighting that this is a gap. And so the more that we highlight that this is a gap, the more chance that we will have to try and address it.
That would be very, very good to know, and to just be able to engage everyone. So thank you so much, Elizabeth. This was very insightful, and we are glad again we are recording these sessions. We'll go back and rewatch and remind you after some time that we're still waiting for that engagement. When are we going to be involved? But thank you so much for presenting for us and being part of this conference. So thank you.
Thanks,
thank you,
Agnes.
everyone.
Thank you, everyone.
Thank you, everyone. We go back to the other link for the other session. Lovely to see everyone engaging in our different sessions. Thank you.